Hello everyone. Today, we're exploring the medication Breyanzi, known generically as Lisocabtagene Maraleucel. As always, this discussion is for educational purposes. If you have health-related questions or concerns, it's important to consult a medical professional. Description: Breyanzi, or Lisocabtagene Maraleucel, is a form of cell therapy used in the treatment of certain types of non-Hodgkin lymphoma, specifically for adults with relapsed or refractory large B-cell lymphoma after 2 or more lines of systemic therapy. This medication falls under the category of chimeric antigen receptor (CAR) T-cell therapy. It works by modifying a patient's own T cells, a type of white blood cell, to help fight cancer. Breyanzi is given as a one-time infusion into the bloodstream. Warnings: Breyanzi carries several important warnings. It can cause severe side effects, including cytokine release syndrome, CRS, which is a response to the activation and proliferation of CAR T cells causing high fever and flu-like symptoms. Neurological toxicities are also possible, which can be severe or life-threatening. It's not recommended for patients with active infection or inflammatory disorders. Before receiving Breyanzi, patients should discuss their complete medical history with their healthcare provider. Before taking this medicine. Before receiving Breyanzi, inform your healthcare provider of any medical conditions you have, especially if you have had a recent infection, are pregnant, planning to become pregnant, or are breastfeeding. It's crucial to discuss all medications, supplements, and herbal products you are currently using with your healthcare provider. Side effects: Common side effects of Breyanzi include fever, cytokine release syndrome, neurological events, low blood cell counts, fatigue, and increased risk of infection. In some cases, severe side effects can occur, including life-threatening infections, bleeding episodes, and kidney problems. Immediate medical attention is required if you experience symptoms like high fever, difficulty in breathing, confusion, or severe fatigue. Interactions: Breyanzi may interact with certain medications or health conditions. It's important to discuss your current medication list with your healthcare provider, including over-the-counter drugs, vitamins, and herbal supplements. Dosage: Breyanzi is administered as a single infusion. The dosage is based on the patient's weight and the number of viable T cells in the product. It is a personalized therapy, created from the patient's own T cells, which are collected and genetically modified in a laboratory setting before being infused back into the patient. Due to its unique nature, the process of receiving Breyanzi is more complex than typical drug treatments. Avoid: Patients receiving Breyanzi should avoid driving, operating heavy machinery, or doing other dangerous activities until it is known how Breyanzi affects them. Additionally, avoid live vaccines for a period before and after treatment as advised by your healthcare provider. FAQ: Many patients have questions about the safety and efficacy of Breyanzi, especially considering its unique nature as a CAR T-cell therapy. It's important to discuss these concerns with a healthcare provider, who can provide personalized information based on individual health history and condition. Closing. That concludes our overview of Breyanzi, or Lisocabtagene Maraleucel. Remember, this information is for educational purposes and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns related to this medication. Thank you for joining us today.